host, and we're going to be talking everything and anything we can about dogs and cats. With me tonight is Dr. Robin Canizero, who is a homeopathic, that's very important, holistic veterinarian. They are different. A lot of times people don't realize that. And she is absolutely fabulous, and she's here to answer all of your questions. Dr. Canizero, welcome.
Hi, Carrie. Thank you so much for having me on again. It's such a pleasure to do these podcasts with you. I feel really blessed.
Oh, I am so blessed that you sign up all the time, and she's so free with her time to help you guys out. So I just can't thank you enough. Are you kidding me? I'm just a girl who wants to help animals. And when vets are willing to come on and help me help animals, it makes all the difference in the world. So I just appreciate you so much.
Well, thank you so much. I really appreciate it. It means an awful lot. And thank you for doing these because I think they're super important for people to help in so many ways.
Oh, I agree. And it's so, in our world, we know that finding a true, real, holistic veterinarian is hard, but finding a homeopathic veterinarian is literally a diamond in the rough. Like it's a whole different ball game. So that's why I made it very clear the difference between a holistic vet and a holistic homeopathic vet are very, very, very different. So
we're probably the very most holistic that one can get because homeopathic medicine treats the underlying cause of imbalances and isn't quite as how do I say it? When we're looking at chronic diseases and what causes chronic diseases, there's an enormous amount of tolerance in the partially holistic veterinarians who are also offering anesthetic dental cleanings and flea and tick poisons and lots of vaccinations, et cetera, or even some vaccinations. So as a homeopathic veterinarian, we understand the diseases that are caused by many of these things that we do as veterinarians. And we are truly the most holistic that you are going to find.
Right. I absolutely agree. And even if I have a couple of times said to people who have said to me, well, I don't want to do homeopathic because it scares me. They're scared. They don't know. And I have said this to, I don't even know how many people. Okay. But if you go to a homeopathic veterinarian, she's going to be the most holistic you're going to find. I've actually said those words. So it's interesting that you say it like that because I'm like,
well,
all right.
Additionally, Carrie, I think I have heard these things sometimes myself because I work with people that get sucked into the allopathic medicine paradigm so much because I have a lot of clients that are quite a distance from me. So if they need something urgently, they'll often go to local practices, emergency clinics, et cetera. And sometimes they'll say, well, I was just so scared.
It's scary.
Was afraid to stop the Apoquil, or I was afraid to stop this medication. I was scared to use the homeopathic medicine. I always say to people, I'm far more terrified of drug medicine than I ever would be of homeopathy. It's not just because I'm a homeopath and I know homeopathic medicines. It's just that homeopathic medicine, it has the possibility of curing. If it can't cure, it can cause no harm. There's no side effects. It treats the underlying cause of imbalance. And so the individual animal or person, if you're a human homeopath, the person can only get better, or worst case scenario, it doesn't help. But in the case of drugs, it might appear to help, but it doesn't last. It doesn't treat the underlying imbalance, and it has a lot of side effects. So I'm far more frightened of the side effects. And then another dangerous phenomena that happens that is under represented and never discussed by allopathic veterinarians because they don't understand this phenomena. It's one thing if like a person or an animal has asthma and they use a steroid inhaler as a rescue emergency measure. It's a medically appropriate drug for the disease circumstance. It doesn't cure anything, but it's medically appropriate. It's far more dangerous if your pet goes in and the vet doesn't know what's wrong with your pet, and they say, well, let's just give a shot of steroids and hopefully it'll help. When we use those drugs non-specifically, it's far more injurious to the animal than it is even if you're using it in a more appropriate rescue circumstance, like a pet that's hit by a car and gets a steroid injection to combat shock. That's far less injurious to an animal than using a drug when you're not really sure what's wrong and you figure, well, let's just try this and see if it helps. Then that usually turns up very dangerous consequences.
Yeah.
So, and I encourage people all the time, if you are scared enough to go to the emergency room, allow them to do reasonable diagnostic testing. And
Absolutely.
a lot of my clients will say, well, I didn't want to do the blood work. Well, if you were scared enough to bring your pet to the emergency room, let them do blood work. Why would you accept a drug medication without having laboratory work done to make sure that there isn't early compromise of the kidneys where a drug might be tremendously injurious to that organ? Why
Right.
wouldn't you do that? Why would you feel more comfortable saying, no, I don't want to pay for the blood work, but go ahead and give all those injections? It
I,
doesn't make any logical sense, and yet veterinarians are willing to do it. I don't think it's good medicine, but I do understand if a client in front of you refuses a procedure or a test, we can't make them do it. But
yeah.
and they're not necessarily going to explain why it's important, which I did when I used to do emergency medicine. And they used to make jokes about me when I went into the emergency room. Oh, Dr. Canizaro's on. We better fire up the chemistry analyzer. She's going to be doing a lot of lab work and x-rays. Better warm everything up because she'll be doing. But I didn't do it to try to suck clients dry. I did it to understand what was going on with the case and situation. Because if I'm going to give any medication, as back then as an allopathic veterinarian, I wanted to make sure that I was going to do no harm. I wanted to make sure that the blood work looked okay or sufficient or supported the medication that I was going to use. I
Right.
wanted to make sure that I wasn't overlooking something where I really needed to recommend hospitalization and
Right.
not recommend, well, give a couple shots, send your pet home, and if they're not okay by tomorrow, bring them to your regular vet. What if the pet passes away overnight? I would feel horrible,
Yeah.
horrible.
Well, I'm going to share a story with you about that. First, I just want to say hi to Eileen. She's up at midnight in the UK just because she wants to listen to you. That's
Hi,
awesome.
Eileen. Thank you so
Welcome.
much for joining us. I really
Yeah.
appreciate it. Makes
Yeah,
me feel
welcome.
great.
Hopefully, we're going to be able to guide you through some stuff. For those of you guys who are secretly watching in the background, please say hi. Sometimes people get shy, and then I always think, is anybody listening? And then later on, I get these emails, Dr. Canizero. There's like, I listened to your. I'm like, really? I didn't think anyone was listening. So if you are there, please say hi. It helps us, it actually encourages us to keep going with these and keep going. But I want to share a story with you. This is no kidding. Just last week, a client of mine's dog started to have, she went into like having some problems. They didn't know, but they knew something was not, Dr. Dodd says, ain't doing right.
Right,
ADR. And
right.
so they
Yeah,
knew
we
enough
all know
to,
the ADR.
yeah, ADR. She always says that to me. It ain't doing right. So
Yeah,
they called around to a couple of emergency clinics who all were booked out 7 hours, 7, 10. One place said
I've been
12
hearing
hours.
that.
So he drove all the way out to this clinic that isn't an emergency clinic, but they're a night clinic. So they're only there in the evening, but
Yes,
they didn't have a whole lot of stuff they could do. And so they did exactly what you're talking about. Well, we don't know. We don't have everything here to do what we should do. And none of the other vets are open and they can't get him to an emergency room. So they gave the dog antibiotics and sent the dog home.
yikes.
Yeah, well, her name was Marshmallow, and she passed away 2 days later. So no one really knows what was happening and what was going on. But I don't even think it was 2 days. I think it was maybe the next day. I have to find out. But I didn't say it was too late for me to say anything. But I thought, God, they just gave her an antibiotic without knowing what they could have made it worse. Like it's just
Right,
antibiotics are not like you're saying with homeopathy. And I feel the same way about food, right? Like food, if I change your dog's diet, maybe it'll help with the skin problems, but it's not going to hurt. Like, let's try it. So
right.
but it's just interesting how that all happens, and I think it is absolutely something we need to be. I'm just so you guys know, I'm at Super Zoo in LA because I'm a junkie as far as finding out new and great things about your dogs, and I'm in a hotel, so I have really bad lighting. And I don't know. So anyway, but so we're going to talk about a couple of different things, and as Dr. Canizero and I are talking, please feel free. This is your time that she's allotted for you guys to ask questions. And, it helps other people. Some people are really shy and they don't want to ask questions. They get nervous. I don't know. I guess I do know why. But I have this question that came through a little bit she's actually a client of mine and she has and we talked about it. I
Yeah,
don't know. We talked about it a little bit before. I'm going to laugh because the reason I wanted to talk, because I can't pronounce it. And so I asked Dr. Canizero, can you tell me what this is? And so we're going to talk a little bit about it, but I'm going to botch it, but it's called Syringomyelia. And I looked it up a little bit, but I have a client and she just wanted to know what you think about that. She has a King Charles Cavalier, which is pretty common in the breed, and what you think would be really good. She has her right now on gabapentin, um,
Oh,
and
yikes.
but ideally they want to wean her off because they don't want her to be on it. But right now they feel like it's the only thing that's giving her comfort. And so she just wanted to know if you thought there was something else that she could do, or something else to make her comfortable, or if she could cold turkey her dog off of gabapentin, or if she could wean her off with something is the real question.
Yeah. It's a very good question, and it is a disease of the nervous tissue. In my opinion, it probably is caused by vaccine damage. I can't say that for sure because, I think it's a grab bag term for some, odd neurologic behavior. But anyway, homeopathic medicine, which I'll sound like a broken record, can treat anything. And it doesn't really matter what the diagnosis is per se. And to some degree, it may not matter about the prognosis. I wouldn't, I can't really advise anybody to take their pet off of a medication, especially because I don't have a client patient relationship with them. There's absolutely alternatives to treatment. If I were her, I would recommend, or my recommendation would be find a homeopathic veterinarian that's either willing to do phone consultations, which we can do very successfully in treatment, or find a homeopath in her area if she has one. That would be great. And there's very few of us in the United States. So sadly, you're not necessarily going to find one. Even for you in the UK, you may not be able to find one very close to you. That's not uncommon. But basically, homeopathy is going to treat based on the clinical symptoms. And so, as far as prognosis, I like to do diagnostic testing principally so we can have an idea of an allopathic prognostic idea, because if an animal has a terminal disease or something that you know that there's an emergency intervention, which again homeopathy could treat as well, but there's certain things we need to follow, like if an animal has diabetes and they have ketones in the urine, we want to make sure that we're following these very closely so that the pet doesn't get worse under the course of treatment. And it isn't that the treatment is going to make the pet worse, but we're trying to catch up from a long history of chronic disease. This disease would be no different. So I would recommend finding a homeopathic veterinarian so that we could institute treatment and supportive care and then wean off of the medication. I think there would be a good prognosis to be able to get off the medication because, as far as I know, I don't believe that this condition is fatal.
Yeah.
I'm not going to say this about a dog, for instance, that have seizures. Oh, we could just take them right away off of anticonvulsant medications. I wean them down slowly after instituting treatment and instituting kind of a baseline of understanding of how they're responding to the new treatment that I'm offering. And then we start to lower the medication. Some can get off medication completely, and some can go on a very, very low dose. One of the things that's important is that symptoms are not your enemy. The symptoms are a signal, and they're a way in which we understand the process of the underlying imbalance of disease. So to make symptoms go away with the use of drug therapy like gabapentin isn't necessarily a great thing, because it looks like maybe things are fairly all right until the disease breaks through symptom-wise. The symptoms break through the manipulation of the drug or the suppression of the drug. So there's always going to be that ever increasing amount. Plus, gabapentin, of course, has a side effect of sedation, and
That's
there'd
what's
be
happening.
loopy
Yeah.
and kind of unsteady on their feet, and you just don't have your happy-go-lucky, playful
Right.
cavalier anymore.
That's
So
what's
it's
happening.
not
And
a
she's gained,
desirable medication.
well, no, I don't know if she's on here or she's going to watch it later on, but she's just the biggest. I mean, she has the biggest heart for animals, as I'm sure everybody who's listening, we all do. And she
Yeah,
wants to do the right thing. But what's happening now is she has this animal who possibly has a condition that's affecting, spinal fluids, and there's all this talk about it. But her dog is gaining so much weight because she's now exactly what you said about the gabapentin. Now she's just sitting there, and King Charles are prone to gaining weight as it is,
right.
and so she's just she's just struggling, and trying to
It's
figure
a
out.
very common side effect. And gabapentin, I want to mention because I think it's important for the listeners. It actually is a neuropathy drug. It's originally used for neuropathy pain in humans. and it is incredibly overused in the veterinary profession. I'm not trying to suggest that it's a completely non-indicated medication for this particular condition. I don't know honestly because I don't use drugs, so I'm not really sure if it would be or wouldn't be an indicated treatment for this condition. But nonetheless, gabapentin is used for everything. I mean,
It's,
your
I
dog
had
breaks
so
their
many dogs.
toenail, they're
Yeah.
on gabapentin.
Yep.
They have a dental procedure and a tooth taken out, they're on gabapentin. They have arthritis, they're on gabapentin. The overuse of gabapentin in the veterinary world is astounding, and it's not getting prescribed correctly because it's a neuropathy drug. It's also an anticonvulsant drug. So most of those types of drugs will interfere with the endocrine system. So it's going to disrupt your pituitary, thyroid axes, adrenal axes. And so weight gain is a potential severe side effect. I say severe because it's so unpleasant. And we know that obesity in animals can lead to a plethora of other diseases, including
Right.
in people: cancer, autoimmune problems. What did they say all during COVID? That the people that were obese and had potentially other comorbidities
Right.
were the most likely to suffer most severe consequences
Right.
of COVID.
That's
That's no mistake, because obesity, unfortunately, obesity leads to a tremendous amount of diseases and suppression of your immune system. And, that's nothing to snuff at. So we don't want to see this cavalier go on to have early congestive heart failure, which could be another sequela. And that's very, very common in cavaliers. And, that I'm not saying that that's going to happen, but, the more we manipulate these diseases without treating at the underlying cause, um, the more likely you are to have a pile on of additional disease problems, including side effects. I've said before, I'll say it again, that side effects in veterinary medicine or human medicine is a polite way of saying the disease the drugs cause themselves. So no pharmaceutical company, no medical doctor, and no veterinarian wants to say, well, let me tell you the diseases that the drug I'm just about to prescribe is going to cause. They don't even want to use the polite word side effects,
right.
and associate that with the drug. And that's a more polite term that makes you not think that the drug is really doing anything too bad.
Yeah.
So be aware that that's exactly what it is the disease that the drug is causing in the individual. And that is exactly what side effects are.
It's oh my God. See, this is why we love you so much, because she gives us the best explanations of things, and I just love it because it's so educational for me. I always learn something new. But one thing you did say that I can absolutely attest to is gabapentin is overprescribed. I'm not a veterinarian, but when I know of dogs that are being given a drug, this has happened, and it actually is done by a holistic veterinarian in my area, or
Ooh,
folistic, I like to call her.
that's holistic.
Out she gives out gabapentin.
Mm.
So before the dog comes in for, or cat comes in for care, so that the dog or cat won't be scared. And
Oh,
so it's just
wow.
to sedate them, to do it, and they give it to them before the dog even goes in. And I have clients that have told me about it. And I said, look, sometimes, we wouldn't do that to our children. Can you imagine if your kid was afraid to go to the doctor and you drugged him? Wouldn't we just say, I'm sorry, this is part of life. We go to the doctors, we get our exams, we do what we have to do. But with our
Wow.
animals, we're not doing that. We're finding these ways that it's not okay. Like it's no one likes it, to go to the doctor necessarily, but we can't drug our animals. I mean, I understand not necessarily, but when you have those really aggressive animals and you're kind of forced with, I can't get in there unless I sedate him, I get that. But this
Yeah.
isn't that. This is just, we don't want the dog to be scared. And
Well, as a homeopathic veterinarian, I get a lot of calls for behavioral problems. In fact, I'll be seeing a new patient. You don't know their name, so I don't feel like I'm breaking confidentiality. She's going to be bringing a cat in that has been uh, absolutely terrified to the point of panic to go to the vet ever since getting a microchip put in. And so she just gets a house call vet, and she said, well, if I she wants me to check the cat's teeth and do a hand scale dental. She said, I don't know. I think I'm going to have to sedate him. And I said, well, please don't bring him in first.
yeah,
Because the bottom line is, if you have an event that causes that great of a disturbance in an animal, that it causes them to be that terrified that they may have to be sedated to be seen, that is a chronic disease problem. that should be treated homeopathically. That includes your aggressive dogs that are so scared they might bite in the exam room, etc. This is an extreme case of fear. It's like the individuals that can't go to the dentist or haven't gone for 10 or 15 years because they have a phobia of the dentist. They're not like crazy people. There's a real intense fear associated with that. But none of us enjoy going to the dentist, but we don't avoid. I just had my teeth cleaned, as a matter of fact, but we don't avoid going to the dentist for 15 years because we're so terrified. Most of us,
Right.
would you agree? And so when we're looking at averages across the spectrum of people or animals, then what I'm looking for is too much or too little. Not going to the dentist for 15 years because you're so terrified is outside of the average. That is something that needs treatment. A dog that comes in and shakes a little bit and goes, "Oh, I'm kind of scared," or "I'm nervous about the blood draw." Well, who wouldn't be? I
Right.
mean, you
Right.
don't necessarily go and get a phlebotomy or a blood draw or something. You sit there and go, "Oh my God, this is so exciting! I can't
Right.
wait to go in and have my blood drawn,"
I'm going
or
to do a
have a
live video
or
about
like that. So, and okay, well, if we have people like that, they might also need homeopathic treatment. They're
it.
on the
Yeah.
other end of the spectrum. I'm just
Yeah.
kidding. Dogs that are too
You're right.
wild and excited, get very mouthy, wild and excited. That's too much. It's
Yeah.
too exuberant. We of course we want all of our dogs to be excited to see other people and such, but if
Sure.
they have like I say that dogs more than cats, we see it a little bit in cats, can have attention deficit disorder or attention deficit disorder hyperactivity. And we do see this in dogs. It's vaccine damage, by the way. But and these dogs are very difficult to train because they can't retain the attention span to be able to manage and control themselves.
Right.
They're trying, but they just can't.
Yeah.
They need treatment. So if we have cases where the animal is too fractious, meaning that they're too aggressive or fear aggressive or whatever, to be able to come in and be handled by the veterinarian, we have to address that first.
Yeah.
Because in no circumstance do I want, I don't know, I think I have a client recently I saw, they said, "Well, if we're going to do the nails, we're going to have to sedate my dog." And I said, "Let's not. Let's work on handling the feed and doing all of these sensitization work. Let's treat homeopathically." If we sedate an animal and do something to them, we are reinforcing that fear because we're chemically
Right.
controlling that animal. we're,
Yeah.
we're convincing them that you're right, this is a terrifying experience, so I'm going to chemically alter you and make you go through it anyway.
Yeah.
Nothing is learned, nothing is gained.
No,
And
you're
so I said,
so,
well,
oh my gosh, so right.
nothing's learned, nothing is gained.
Yeah.
And if we think that animals don't have that kind of ability, you're sadly mistaken. Then how can you teach them to do agility and fetch things and be service dogs? Of course they can think
Right.
through
Right.
things. Of course they can have experiences, positive and negative. We need to help them through those experiences. And I'll tell clients, well, practice restraining your pet at home, the ones that go
Yeah.
ballistic with restraint.
Yeah.
We're going to treat homeopathically. So we're going to try to help through that process. Now, granted, some of these dogs are not going to become your couch potato dogs. You could do anything you want to them whenever.
Right.
But we need to get them to a place where this isn't so terrifying. This isn't so traumatic for them. And
Right.
I think it's so important because just as you would do for your child, would you say, well, suck it up, we're going anyway. I don't care. We'll pin you down and give you your shots.
Yeah. Yeah.
Do we do that with our children? Maybe with the infants, but I don't want to go there. I think that's a terrible idea too.
Yeah.
But the what trauma we induce by doing these things, we compound the problem.
Well,
So
yeah.
this
Imagine
individual
waking up
animal, I'm going to treat her
feeling,
cat first for the trauma, the previous trauma, so that maybe we can get to a point, and maybe I could do it on the first day I see her. I don't know. We'll see how bad the cat is. He may not be that bad. I don't know. We'll
yeah.
have to see. But nonetheless, let's see what we can do within the bounds that is comfortable for the cat. Tomorrow is another day. A month from now is another period of time where the homeopathic medicine can work, where we can allow that animal to have a positive experience in my office and not say, "Oh my God, she pinned me down and she drew blood, she did my nails, she hand scaled my teeth, I put a muzzle on me, stuck her fingers up my rear end, and and then I went home."
Yeah.
So let's not push them over the limit. It doesn't mean that we're being sissies and saying, "Oh, honey, it's okay. We're not going to do anything." Let's go in there and be reasonable and allow them and give them an opportunity. A typical visit in my office, if you're close enough to me, is that I have the person come in, sit down, and their pet can wander around my office as they please. I do not do a physical exam first, almost never,
Right.
not
Perfect.
even with a cat. Let them sit, hang out in the carrier, so that the minute they come through my door, they're not getting assaulted. Oh, I got a temperature and a heart rate and a respiratory rate. We don't need that, right? I mean, unless an animal is in critical condition, but I don't normally see those guys. They're usually at the ER. So let's give them a chance. And then I do all of my intake information, find out history, go through the medical records, et cetera, with the client, ask a lot of questions, answer any of their questions. Let's give them a chance and let's not chemically alter them. And why should we assume that every one of that veterinarian's patients needs gabapentin? How many times have you seen the dogs that burst through the vet's office and go, "Oh my God, hi, everybody"?
No, it's crazy.
Gabapentin for?
And a lot of times clients think their pets are going to act a certain way and they don't. And so you're just assuming based off of what the client tells you. A lot of times clients will do it. And I'm like, well, let me just see. But to your point, but real quick, I just want to say hi to Julie and Victor. Hi, guys. How are you? Welcome.
Hi, Julie and Victor. I saw you come right in. So thank you.
I just want to make sure I'm acknowledging people. Because it's important. We can't do this show without you guys. So it's important that you're there and listening and hopefully passing on any information that you're learning here to your friends. Because we can't, this movement that I am so proud to be a part of change in our pets is so important for me to see it before I die someday, because I'm tired of watching the illnesses and stuff. But, it's so interesting as I see a lot as a grooming shop, we see dogs come in all the time that are so afraid to walk in the doors. And so I couldn't even begin to count how many times, which is why I don't do nail clipping on dogs. We don't clip anybody's nails. We only Dremel because frankly, my dogs that I've started from puppy to adult, because I've been there 21 years, are not afraid to have their feet touched. And a lot of that is because I never traumatized them in the first place. But those ones, to your point, that are traumatized, sometimes clients tell me, no, I'm not going to do that. It takes too much time. But a lot of clients will go for it because they've been told they have to be sedated to have their nails done. But I have clients bring their dog in, day one, and we don't do anything. Just bring him in. I'm going to give him a treat. I'm going to say hi to him. I'm going to get to know him. And then tomorrow I'm going to have you do the same thing. And we may have to do that 3 days in a row before I ever even begin to touch the dog's feet. Just like you're saying, like to grab a cat out of a kennel, slap him up on your, stick a thermometer up his butt, right, in 2 seconds. How freaking, come on. When do I get to go back for that? That was fun.
I can't wait. I'm barging through. I do get feedback a lot that animals, I wouldn't say cats because most of the time they're carriers, which is a good thing. Some of them are in harnesses and leashes, but the majority are in carriers. But most of the dogs are just pulling to the door and, happy to come in. And I tell my clients too, with puppies or animals that need grooming, I'd say, do your research, go to a really good groomer and just go and have almost nothing done. Just go there. I have animals that are too terrified to go to a vet office. If they're not close to me, I said, can you just take them to, research the vet office or whatever? Ask them, is it okay? Can I just come in and get my dog weighed and leave? And or not even just walk in the door, get a treat or whatever and leave. What we want to do is to help animals understand that it's just not going to be the worst experience of their life to do this. Because just imagine, if you have a serious health issue, and this is what I say to a lot of people who have dogs that you can't handle or cats you can't handle. What are you going to do when you have an emergency? Is that the time to thrust them into a situation where they may be too unstable to sedate? And now we want to get blood work or x-rays. What are we going to do? What do you do then? You can't say, oh, got to go scramble around because now maybe it's not safe to sedate, as I just said a moment ago. So it really makes sense, get them used to things, get them used to the car, get them socialized, wouldn't you want your world not to be scary? If we have a sheltered life, of course you're going to be scared of things. And I want all animals to live a rich, fun life. It doesn't mean you have to go to dog parks where it's nuts and people are irresponsible. But maybe you go to a different dog park, which is quieter, where there isn't as many animals or something like that. Or maybe you go to a dog park and you don't even go into the area where the dogs are loose. You just walk around where the chaos is so the pet can get more acclimated. There's so much that we can do. And homeopathy can help if there are things that are outside of average. And I hate using the word normal. There's no such thing as normal. And we all know that. But if you have something that is too much, too excessive, too much scratching, too much ear discharge, too much pain, too much stiffness, too much fear, too much anger, too much aggression, that's anything that's too much or too little, too lethargic, too fat, too overweight. I'll be more polite. Too skinny, even if they eat really well. These are things that should be treated and not consider, oh, worry about it, it's normal. Your cat throws up hairballs frequently, and it's not average. Cats
I
should throw up hairballs once or twice a year.
I just got it. I should say got into it, but I just had a discussion with somebody who absolutely disagreed with me and said she's had cats all her life, and cats they just vomit up hairballs. And I'm like, well, I've had cats my whole life, and I own a cat hotel, and I'm just gonna say it: the raw fed cats don't throw up hairballs. I don't.
Mhm.
They just don't. I have 4 right now. I've never seen a hairball once from any of them. Now, granted, they're kittens. None of them are Persians and all of that other kind of stuff. But I don't.
But it's not about long hair. There are plenty of Persians and Himalayans that aren't throwing up hairballs all the
Right.
time.
The raw
And
fed
it
animals
is it's a
are.
it's a gut problem,
Yeah.
and it may be able to be fixed by raw diet. It may need raw diet, or may need the cat may need a home prepared diet or a raw diet and homeopathic medicine.
Yeah.
Maybe microbiome testing, maybe
Something.
some supplements, but homeopathic medicine certainly is very helpful, especially if a change to a whole food, real foods diet doesn't resolve the hairball vomiting issue. Then there is more going on. I have seen some raw fed cats that do throw up hairballs. I'm going to say that the cats that are on whole foods or raw food, which I still consider whole real food,
Right.
if you're on those diets, you see much, much less or very little hairball vomiting. But
Yeah.
if they're on kibble, canned food, we see tons of it. Plenty, plenty,
Tons of
plenty.
it. Tons of it. Because of the cat hotel that I have, the kitties that are eating kibble, I'll go in, because they're in suites and I have to clean out their suites. So I see a lot of
Mhm.
almost every morning when I go in, a hairball. The gut is really the issue because I think the reason why my 4 kitties right now, I've never seen a hairball from any of them. They've been raw fed from bottles. They were bottle fed raw goat's milk. So their gut microbiomes are very healthy. They've never had an
Well,
antibiotic.
that and again, if you don't vaccinate or over vaccinate them, because that's
Right.
another way to cause gut damage.
Yeah.
And I'd like to say too, because I think this is critically important, and this is something that comes up an awful lot, almost on a daily basis in my practice. People will call up, even this particular woman who wants me to check her cat's teeth because she was told by her mobile veterinarian that her cat needed a dental cleaning. Dental disease or gum disease is a gut problem, my friends. It is not a mouth problem. You can band aid it over by getting a dental cleaning if you'd like, which I don't necessarily recommend that you do. But if you don't fix the gut, then that dental disease is going to continue
Yeah.
unabated,
Yeah.
almost always,
No,
uniformly. And
it's
we
so
can keep
true.
veterinarians in business for a long time coming in for your annual dental cleanings. Or if you're lucky enough, I'm sorry to pick on the corporate veterinary offices, you can buy an expensive monthly plan and have dental cleanings included in your monthly expensive monthly plan, which I don't think they're worth it when I see what is offered. So, it wouldn't be something that I would advise people to do, but I know people do it, and I've recently
Sounds
had.
good. Sounds good. And I know a lot of people that do it. I just had a client a couple weeks ago because I have a veterinarian that comes in and does non anesthesia scaling and all that kind of stuff. And so I was talking to her about her dog, and I always talk about preventative. I'm like, we need to get your dog on a better diet and give him some chicken feet to chew on, that kind of thing. And I said, what do you feed your dog? And she told me, and then she goes, and then of course I always give the kibble to clean the teeth. And I said, well,
Wow.
if that worked, we would not have had to just give your dog teeth, get the teeth done. So I told her the same thing. I said, it's really a gut issue. And then, we went in, the teeth were perfectly clean. We had just cleaned him. And then, she went down there and she wanted to smell his breath. And she's like, his breath still smells. And I said, I told you it's not. And we just cleaned her teeth and they were spotless. Inside, outside, above the gum line.
It's a gut problem. It's absolutely a gut problem. And if we don't fix the gut, then you can expect either the bad breath to stay. The other thing I want to say, which is a good point that you brought up, and I want to really expand on that a little bit, is in veterinarians, I just was talking to a client today because she lives part-time in Ohio, part-time here in Florida. And we did a telephone appointment today. And her one little Shih Tzu went to the vet and they said, oh, he needs a dental cleaning. And they gave a whole list of things that this poor woman could do to help her dog's teeth, including the CET chews, which are garbage. They're sold by vets, I think, and you could probably get them at Chewy's too, but please don't.
Yeah, they're
and that, kibble would be a good idea because it cleans teeth. I got to tell you, dogs and cats have shearing teeth. They're intended to rip flesh, from the bones and, rip chunks, and they largely swallow their food whole. We have grinding teeth. We chew. Dogs and cats don't chew much at all. So I promise you that the kibble is never going to clean an animal's teeth.
Never.
And how many cats and dogs do we see that are in for dental cleanings and they've been living on kibble? If that was working so well, you would never have to have a dental cleaning.
Well,
so
because
the pudding, if nobody wants to believe me, and then kibble is not appropriate diet for the gut anyway.
Right.
So now you've got a gut problem. The kibble doesn't clean the teeth anyway. So please don't let anybody tell you that kibble is necessary to clean teeth, because it is far from it. And I hear it even from veterinarians that should know better. I mean, don't they know the species that they're working with and the anatomy and physiology of those species? I'm embarrassed to say it doesn't sound like it.
No, it doesn't.
Just because cats and dogs are domesticated, they still came from wild species in the wild. We need to pay attention to their habits, behaviors in the wild, and appreciate what the anatomy and physiology is all about. So I hope that helps some people. And kibble is really a terrible food of any kind. Don't care if it's organic or the cheapest. Of course, cheapest is really, really terrible. Old Roy or whatever, or maybe I'm not supposed to say names or something on here, or even Hills.
It's so sad because I always say Old Roy too, and then I'm like, do they even still make that food? I don't know.
Oh, I believe they do. Yeah, Diamond. I run quickly, but anyway, it doesn't matter. I've never met a particularly good dry food. That doesn't mean you would ever use it. Oh boy, it's going to start to pour here, so it's going to get.
Oh my gosh, I'm so jealous. I love weather, like intense weather, like raining.
I can disconnect my computer and try to move to a different location. So you let me know if this gets so.
I'll let you know. I think we can still hear you. Everybody, you guys good? Everybody good? Can you still hear Dr. Canizero? Thumbs up. Let me know. I noticed that one of the things that the veterinarians say, if their animals are eating kibble and then their teeth are rotting out, and then the owner says, well, you said that kibble would clean the teeth, then the vet always says this, oh, well, it's genetics for your dog.
I liken it to the ear infections that, veterinarians say, well, if you just, not skip that 1 or 2 ear treatments, then, there you go.
Yeah.
Then you wouldn't still have the ear infection, which is rubbish. And so too is the genetic theory. Now, granted, some animals have crowded teeth, but that doesn't honestly mean that every animal with crowded teeth are going to have substantial dental disease.
Right.
They don't. Right. So again, it's a gut problem. Over and over again. I want to say it's a gut problem.
It's a gut problem. It's a gut problem. We're going to get you a t-shirt. #, it's a gut problem. You're going to have to wear it. And we'll put a little poop emoji there for you.
It looks like I didn't put my glasses on, but we have someone nice. I like their little
Janelle.
Hi, Janelle. West Coast. It looks like in Florida.
Yeah, she's in Florida with you. She says it's raining
there. I'm on the West Coast. Yeah, well, I'm on the West Coast too. I'm in Brooksville.
Oh, so, yeah, Janelle, where are you?
Janelle's name with that.
Close? Do you know Janelle?
I don't know. I don't know where she is because I think she said West Coast, but I think she means West Coast.
West Coast. Well, she's lucky if she's anywhere near you. She's lucky. So we talked a little bit before we started, and we were talking about how to navigate a little bit through. She's in Pasco
Oh,
County.
yeah, you're close. Janelle, Pasco, I'm in Hernando County. So I'm very close, Janelle.
Very
But you
lucky.
can go to my website, and Lori will provide that for you.
Yeah, Lori, it's all up on
Check
the
out my
screen.
website and see if it's of interest to you. I'm sorry to
Yeah.
interrupt.
For the rest of you guys, Dr. Canizero does consultations. Hopefully, we're going to keep our pets on the straight and narrow and healthy and eating the right foods and stuff. But in the event of, she does do consultations, so she can help you out there. But just to get back on track a little bit, but off track, get on track to get off track. We were going to talk a little bit about navigating this nightmare of trying to figure out, how do we navigate with our veterinarians on what we're doing and how we're doing it. And I don't know, just tell me. She says you're very close. That's awesome.
Yes, we are. Yeah,
Yeah.
she's not far at all.
Yeah.
That's a good question. And there's two major ways to address this, or a couple really. If you're working with a homeopathic veterinarian, I always tell my clients, and I would also advise people even if they're allopathic, but let's start with if you are working with a homeopath. If you're working with a homeopathic veterinarian, I generally tell my clients that if they do go and have an examination, to make sure that they tell the veterinarian, please don't give my pet anything by mouth or an injection without coming and speaking with me first. The exception to that is if you're having a dire emergency and your pet just got hit by a car, might be bleeding out, do what you have to do.
Right.
Just do it. Do what you got to do. We'll try to deal with things later. But if the animal is relatively stable, get the information and data you need from the veterinarian. Don't be afraid to ask questions. Don't be afraid to question anything. And don't be afraid to ask, is this medication, life saving, for example? Because many veterinarians will often be a hard sell and a hard push. Well, you better give these antibiotics, otherwise your pet is going to get an infection and die. Well, prove it to me. I mean, did you see something in the blood work, or was there something? Tell me what you saw that indicated that my pet was so ill that it would be dangerous for me not to use this antibiotic. So have them answer that question. I mean, a lot of times they'll kind of flail around a little bit and then maybe, oh, well, maybe it's not dangerous, but I really advise it. And well, then you're getting closer to the real deal.
Right.
So find that out. Don't be afraid to allow them to do diagnostic tests if they seem indicated. And I want you to use as much common sense as you can. And I tell people, take a deep breath, because when you're in an upsetting or frightening situation, it's really hard. Your brain synapses are going and you're frightened and you can't think and you're, I don't know, I better let the pet do whatever. And I want you to take a deep breath, because if you're in an emergency clinic, they probably or hopefully have a lot of life-sustaining, things available. So heaven forbid, if things turn really bad, they're going to be capable of handling it. So likely that's not going to happen. But allow proper diagnostics so you can have some idea if you should be, have a sleepless night, or if you can say, oh, thank heavens, everything looks good on the blood work. Thank you. I just would like to have fluids and a vitamin B12 injection. No, thank you. I don't want the anti-nausea medication. I don't want the antibiotics. But could you please do these things? Because fluid therapy under the skin and vitamin injections are not harmful. Things like, stomach coating agents, like some of the enteric coating medicines, are really not all that harmful. But the anti-nausea medicines, and God knows Serenia is like everyone's favorite. That drug can have some really bad side effects. So
I
while
just told a vet
it's used, don't automatically accept it. Don't accept that if your dog or cat is quote unquote diagnosed with pancreatitis and they're sitting in front of you and the doctor says, well, pancreatitis is very, very painful, so I need to give a pain injection. And your cat has the tail up and rubbing on your hand and, you're petting and there's no, really upset. Why do they need pain medication? Pancreatitis doesn't always equal severe pain sufficient for pain medication. If your pet has surgery, it doesn't mean you have to use like 7 or 8 days or 10 days of pain medication. You know your pet really, really well. If the veterinarian says, oh, this must be very painful, like my client earlier, the veterinarian told her that her mouth must be really painful because her dog had gingivitis. And I said, well, is your dog pawing in his mouth? Is he yawing? Is he backing away from his food? Is he acting like an electric shock hit his mouth when he tries to eat? No, no, none of that. If you could touch your dog's mouth or gums and they don't wince or jump away, they probably don't have significant mouth pain or significant tooth pain. So I don't think veterinarians are using all of their senses these days. So I want you to do that so that you can help advocate for your pet and not accept unnecessary medications. More isn't better. And no, it's not true. Well, don't worry about it. At least it won't hurt. That's not necessarily true. So
Yeah.
make sure that, and just know that fluids under the skin is pretty benign. In my opinion, you can talk to some homeopaths and they'll say, no, 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 that could interfere. I don't agree with that. I think that it can be supportive. And if the pet is not feeling very well, it can give, especially cats, it can really give them a good boost, especially elderly cats. So be willing to do those things. Now, if you're not working with a homeopathic veterinarian, still take a deep breath. Listen to what the veterinarian has to say. Um, Ask questions about the medications being given. Make sure that those medications make sense to you. Even you don't have to be a veterinarian for not to make sense. Just like I said about pancreatitis, and we need to use pain medication and 5 different whatevers. Ask the questions. See if this is something you really want to do. Make sure that adequate tests have been done to assess whether or not that medication, like Serenia, won't damage the kidneys, or Convenia, which I hate any of those. I don't like those long acting, terrible medications. And, so use some common sense to help you navigate through that. Ask questions about tests that are being proposed and focus more on tests that are less invasive. For instance, if your vet feels very confident that your pet has a herniated disc, do you really need an MRI if you're not inclined to do surgery? Understand that there may be alternatives, so take the time necessary to investigate alternatives to see if they may be a better option rather than a surgery for herniated discs. Because acupuncture, Chinese medicine, and homeopathy can treat herniated discs brilliantly without surgery and often cheaper. And an
So I was
MRI is
gonna
expensive, and they have to go under general anesthesia for an MRI. I'm sorry,
before.
go ahead.
No, it's okay. I just wanted to ask this before we get too far away from it. But I've had to over the years take a lot of dogs to emergency clinics for any number of reasons. And I did take a client's dog one time in. It was a really sad case. She had a heart attack. But when we first went in trying to figure it all out, the vet came to me with a list of all of the tests they wanted to do. Like it was just the list of tons and tons and tons and tons and stuff. And some of it made sense to me, and some of it, and this is my question to you, how, like, I think we should do all the diagnostics like you're saying, but do they all have to be done at the same time? Can't we just say, well, let's start here, and then if
You're talking to an ex emergency vet. I'm going to say that the emergency work I did was some of the most valuable work I did as a veterinarian,
yeah,
because we learn how to triage and solve problems fast, because you don't have the time to the luxury. The difficulty with doing that, and I would still ask questions. Number one, if you don't understand a test or the why of the test, then please ask questions.
okay,
You deserve answers to that. In answer to your question, what the veterinarian is trying to do is to get permission to do all of these tests, and then they'll start doing them. It takes a lot more time to keep coming back to the room and saying, can we do this test now? Will you approve this one? Will you approve this one now? They just want to go down the list and be efficient.
right,
So now I'm not saying that some of my colleagues, especially at the big corporate practices, might not have some deep pockets and really just want to do everything. But a lot of times it has to do with what I said just a moment ago. And so find out what the top group of tests are that veterinarian thinks are targeted, super necessary, and target those tests, especially if you're on a budget. And if
right,
you're on a budget, don't be afraid to say that. Like, I have clients that come to me, and some people have a lot of money and some people are on a very fixed income. And they say, well, if I can't afford to do the blood work, the baseline blood work today, how serious is that? Well, the
yeah,
pet overall is doing very well and stable. If a pet is unstable and they might die at any minute, it's probably more important to kind of give them a green light to do anything non-invasive that seems appropriate to do to the best of your ability to determine that. If your
Yeah.
pet is stable, and let's say your pet has diarrhea and they're a little under the weather, well, who wouldn't be if they had diarrhea? You think they're going to be jumping around and wanting to play ball in the yard and frisbee? Well, probably
Right.
not. But if they're pretty stable and they're wagging their tail and going, oh, it's so nice to see the vet, and they want to do x-rays and, ultrasound and blah, 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 and blood work, and then maybe that's not all necessary. Um, First, get a good, thorough physical exam, which some of my colleagues just aren't doing. I
Right.
use all my senses in exam. I smell, I look, I feel, I touch, I palpate. Um, I palpate down the spine. Even if you don't come for a primary complaint of, spinal pain, I'm going to feel all over that animal because I want to get to know them, to the point that they're comfortable with. And most of them are pretty okay with it by the time they've been bored in my office for like 45 minutes while I'm getting the other information that I want to get from the client, and let the animal just chill out and go, well, this isn't so bad. Nobody assaulted me the minute I came through the door. I guess I'm kind of liking this place. I got to get the little chew toy and, a squeaky, and some of them are running around with squeaky balls in my
Yeah.
office or something like
Yeah.
that. And we can't hear each other because of it, but whatever. So it
Well,
depends on the circumstance in answer to your question, but
yeah. Well, the
ask
reason
questions so you can understand that better.
yeah, the reason I bring it up is because I've seen it happen so many times where they get approval for all these tests, and then test number one was actually the answer. And now there's no money for treatment because we ran x-rays for a little bit of diarrhea when in fact we didn't necessarily need to go down that route. So
Well, that's why I'm saying I want you to ask critical questions, and you could put a line through that list and say, okay, I understand what you're saying about, doing the chemistry panel and the complete blood count and the fecal, and put a line there and say, well, I'm authorizing this. And then could you please check with me before you go on to do these other items
that's
on the list?
that's the good
Because what
point
happens
because
is once they
yeah,
go to the
that's it.
back, they
Yeah,
draw the blood and they go, okay, take Fifi in for the x-rays now, and then they're waiting on the blood work.
that's
And
that's
so
my that's the point
that's
right there.
not what vets want to do because they really want to get it all done quickly,
Yeah,
especially in the emergency room, because it was the bane of my frustration, because sometimes people would do that to me and I'd be like, well, I understand why they're doing that, but I'm trying to get this done. But
yeah,
most of the time, the list that I would give them was really a very reasonable uh, list for the things that I thought it wasn't likely that the blood work was going to tell me exactly what I needed. I need the blood work for this, but I need the x-rays for this.
right.
So if that is, if they answer you that way, that makes more sense than, well, we're going to do blood work, but in case of shit, we're going to do this. If they want to do x-rays and they didn't even palpate your dog's abdomen, I have a problem with that.
Yeah,
So
yeah,
if there's no abdominal pain and I don't feel anything in the abdomen, well, why not do blood work in a fecal first, for example, if the pet is unwell and it's very
sure.
unusual for them. If you bring a pet into the emergency room and they have a chronic history of diarrhea, it's like, well, do you really need to do thousands of dollars of tests? Maybe not. But if you remember that your veterinarian said, you know what, your pet, really had borderline pancreatitis, those pancreatic values, which by the way could be a digestive problem and not necessarily pancreatitis. But if you knew those were borderline before, it might be appropriate to go ahead and have some blood work done and make sure they didn't spike. Or let's say a history of elevated liver enzymes and they're throwing up now. Then it
Yeah,
may be reasonable, even though, well, I had that done a month ago, it still might be reasonable to say, well, I hope those liver enzymes haven't spiked and gotten substantially worse. Then yes, it's indicated to do that. Do you need to do x-rays? Maybe not. So if they're not telling you, I need the x-rays because I felt XYZ, or gosh, the liver felt really large and the enzyme values are really big, I'm concerned about a tumor, that makes sense. Okay,
yeah,
I get it why you want to do x-rays. So I want you to sort of fathom through that so it will help you make decisions about how to proceed when you're at the vet's office instead of the runaway train.
this
I
is
don't know if you got Blue Pearl out your way. Do you have Blue Pearl, which is a corporate
yes,
specialty in ER clinic?
yes, yes, yes.
I
I'm
call them
sorry.
the absolute way train of veterinary medicine.
I know,
Nobody
I
gets
know.
out of Blue Pearl around here anyway without probably spending $5,000 to $15,000.
I
And
know.
then at
The
the end of
same
that,
here.
they say, well, I can't afford to come and see you, Dr. Canizero, because I just spent $15,000, but there was really no effective treatment at that
No,
point.
I know. Yeah, I know.
And
We have one right by me and I avoid it. Yeah. Well, this
yep.
is why I want to, I want to talk about this, because when you are, even if you're not in an emergency situation and you go to the vet, but your pet is ill, you're really in a really awkward situation and you don't know what to do and you want to do what's best for your pet and all these emotions. So this is why we talk about it. This is why I come on every week and I want to get it in people who are
Well, that's
listening
why I
to
want you to
constantly.
take a step back. I know this
Yeah.
is your loved family member. I know mine. I loved family members.
Yeah.
Absolutely 100%. Take a deep breath, take a step back. Fight
Yep.
for your pet in the sense that if it sounds invasive, it sounds potentially dangerous, if it doesn't make sense to you and they can't make sense of it to you, then maybe it isn't essential. If they can't convince you why it's essential without blowing smoke up your skirt, so to speak, then I think you need to take pause on that. And it's not that it's okay to question the veterinarian. It's okay to do that, both your day vet, your emergency vet. I think it's really a good idea. But do that list, like I said, draw lines. I'm okay with all of these things and put your initials, they say. And then on the bottom, just right there, say, you must come and speak to me before proceeding beyond this line or
Yeah.
with these additional tests. They
Yeah.
may not like it, but you know what? So what? I didn't
Well,
necessarily
the
like it
thing
when I was
is
an
that,
emergency vet, but I understood it.
yeah. Well, if you end up using, Eileen says this drawing a line is such a perfect thing. And I'm glad you said it too, because it's awkward and we feel uncomfortable saying that because you don't want them to think you don't love your pet. But the reality is if you find the answers in those first two tests, then I have so much more money for treatment. But if you run all these tests and then it's like, okay, I just spent $5,000 on tests and now the treatment's another five. Well, I only had five. So now where does that leave
Right.
us? So that's my
Well,
problem with
I want to speak to your point because this is extremely common. I hear it all the time that, well, if I don't want to take that medication or if I don't want that injection or if I don't agree to do a certain test or do the surgery to remove the growth because Dr.
right.
Canizero said that it could open Pandora's box. You don't have to say that to the other vets because they don't understand that. But removing growth can open Pandora's box and make things substantially worse. So we don't have to tell them those things, but under no circumstances, I don't believe that we know the people that don't care about their pets. They're the ones that are abusing them, tying them up outside, never bring them to a vet. Well, I shouldn't say that. Some people that never go to the vet don't go to the vet because they don't want to be subject to all of the junk that veterinarians sell. And
Right.
that makes me really frustrated about my colleagues because I think you should go to a vet at least once a year. But
Right.
you need to go to a veterinarian that's going to support what you want and desire and not sell you a bunch of crap.
Yeah.
Vaccinations and flea poisons and and dental cleanings and chewies and medicated poisonous shampoos and drugs and whatever. Just my Pebbles, my little adopted French bulldog, she was on Apoquel. She had like really minor skin afflictions, but just because she was licking and chewing some, they put her on Apoquel, which is a cancer-causing drug. And she was only a year and a half old. So I begged the foster person, could you please take her off that medication? I'll handle her allergies when she gets to me, but please take her off that medication. Will you promise me you will? Okay, no problem. They did. And she's hardly had a skin problem. Now, of course, she's raw fed and,
Right.
on whole real food. I don't vaccinate her. She does have some chronic disease issues, some digestive issues I'm still working on. But again, I just, use some common sense. If they're licking and chewing a bit, it's unpleasant. We don't like that. But these drugs are so dangerous.
I know.
I mean,
I
don't
know.
just because Cytopoint's the newest, latest, greatest, and Apoquel's fabulous, these are cancer-causing drugs. And if the vet won't tell you what the side effects are, what these drugs really are, you can find it on the internet really easily.
Yeah.
And reading side effects will make your hair curl if it isn't curly already. I don't have very much curl, so just sort of stuck with straight hair. I've got a little wave now that I went through menopause. It's kind of exciting many years ago. I'm like, oh wow, now I have a little bit of wave, but you can't really see it
Uh,
too much. So I hope that that's helpful. Please don't feel like you're a bad pet parent. If you brought your pet to the emergency room, unless your pet just got hit by a car and you panicked and took them there, but you don't care
right,
about your animal, maybe you have that situation, but I doubt it. I don't doubt for one second that the majority of individuals that are either listening to this podcast or are bringing their pet to the veterinarian on any
okay,
regular basis or won't go because they're scared what the vet will do are
right,
not bad pet parents.
right.
And I don't care what the other vet thinks. It's almost like saying, what do you care what somebody else thinks?
Yeah. It's hard because vets, I had and this is almost embarrassing to say because I'm still mad at her, but one of my girls that works with me got sick and she did not call me first. I'm so mad about it. She took the dog to some random veterinarian, like just some random vet that I never, right? Hello. She takes the dog there. Well, I rescued this dog a long, long time ago before she ever worked for me. And the dog was a seizure dog, was on all these medications, and I took him over and I put him on raw diet and got him off his meds. He's never had another seizure. And I had him for about 5 years when she started to work for me. And she fell in love with him. His name was Bo. And she's like, can I take him home? And at first I was kind of like, I don't know. But then I kind of thought, oh, it might be nice for Bo to have his own little bed to sleep in and not always have to share it with 80 other dogs that are running around. So she took him home and she dresses him up all the time and she loves him. Well, apparently he got into some bread or something basically and his stomach blew up and she freaked out and took him to a vet, which is fine. Well, anyway, then she calls me and she can't afford the vet bill. And so I said, I'll pay for it because she has been now taking Bo. And I said, what are we doing? So anyway, so the vet wanted to do X, Y, all this stuff. And I ended up saying, no, 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 and whatever. And so as she's leaving, she's reading me the bill so I can give her the credit card. And Serenia is on there. And I said, or Cavina is on there. And I said, no, we're not. And she just flipped out on me because I wouldn't take that. So my point to that story is I know how hard it is. And sometimes I know the people that we work with will say, I just took the drug and didn't give it to my dog. And I wasn't going to do that day because I didn't want to pay for it. I'm like, look,
Right.
I'm already paying for
And
stuff.
some of my clients will take the medication, just to
Yeah.
shut them up. But some of these animals get injected with that stuff.
Yeah.
And that's where I really want to draw the line. So
Yeah.
if you feel better taking the medication to placate the vet, so be it.
Sometimes it would have been easier for me,
but
yeah,
the thing is, I also tell people it's good to have your medical team. Know where you would go if you have a situation where you need to go somewhere. Know that ahead of time. I
yeah,
tell my clients that are in other states, find a veterinarian, go shop around, check them out, maybe have a little mock visit, see how you feel about that veterinarian. Talk about the things that you're working with a homeopathic veterinarian. Would they be willing to, work with somebody who works with a homeopathic veterinarian that would be instituting treatment? And if it's a hard no or they go ballistic about something,
yeah.
then don't go back there again. You
That's such a
shouldn't
good
have to put up
idea.
with that. Or even if you're go to allopathic veterinarians, if they're giving you a hard time about something you don't want or don't feel comfortable with, you're not at the right place. Go
Yeah.
find another veterinarian that you feel comfortable with that will listen to you, will work with you, will explain things to you, will go over it with you, tell you
Mhm.
why whatever is important, discuss the pros and cons or if there's an alternative, and don't get angry with them because they're not a homeopath. Go find a homeopathic veterinarian. They
Right.
don't know homeopathy. They can't comment on homeopathy. They can't say it's garbage. They don't know. They're not a homeopath.
Yeah.
If they're not a homeopath, then they can't say that homeopathy doesn't work or it's ridiculous. I
What
know allopathic medicine and I know homeopathy and I know what they both do. So,
it's would be such
make
a
sure
good
you're working with
idea
somebody like that.
to interview your veterinarian before your dog needs to go.
Yes,
Go and just
do
make the
it.
appointment. And when they say, why are you making the appointment? You can just say, I just want the 15 minutes to talk to the vet. I'm not bringing an animal in today.
Yeah,
And
or
and
you
find
can bring
out.
your animal in. They don't even have to have an exam. You can come in and see how your pet responds to the vet.
Yeah, there's
Do they
that
seem
too.
to like the vet? Do they seem to like the environment in the vet's office?
Yeah.
Are they terrified in that vet's office? Is it chaotic and noisy?
Yeah.
Even a cat, go in and pay for an exam. If you like your vet and you feel rushed and you don't have enough time, and you've said this before, Carrie, ask them if they would book 2 appointments for you
Two
and
appointments.
be
Yep.
willing to pay for it.
Yep.
Because I charge by my time, so I charge by the hour. I think every vet should charge by the hour. Because if
Yeah.
they give you 5 minutes of their time, you deserve to pay for 5 minutes
Yeah.
and not for 15 minutes.
Right.
Because the vet tech is doing most everything. And I'm not slamming vet techs, but I don't know about you, but I don't want to pay like $10 a minute and have like 5 minutes of the vet, and the rest of the 15-minute appointment is with the vet tech, and I'm still paying
Right.
$10 a minute. So I don't know
Right.
about you, but I don't think that's particularly fair.
Although it does just it my little joke is, I don't know, sometimes I've met vet techs that are better than some of these vets.
Well, sometimes they are because they're more
Yeah.
enlightened and they may be more open-minded.
Right.
There's a lot of
Right.
veterinarians, and you have to find the open-minded veterinarians.
Right.
I think an open-minded veterinarian is worth their weight in gold, because an
Yeah.
open-minded veterinarian may not understand something, but they're willing to tell you, well, I'm not really familiar with that, but if that's really working for your pet, I support it, whether it's raw diet, working with a homeopathic vet, instead of the ones that are Nazis. Oh, raw diet is dangerous and your dog's going to die or your cat's going to die of salmonella. Ridiculous nonsense. Has never happened to my knowledge.
Never.
Where have all the
I haven't met a
recalls
single
been?
person that can say that that's happened. No one has ever
I've
found.
never heard of it.
No. And
I never have.
salmonella, what bothers me about that argument is that if we took all the kibble fed dogs we could find right now and ran stool samples, they would have salmonella in their poop, but the dog's
Probably.
fine. Yeah.
Right. Well, they
So
did a study on raw food and found salmonella in the feces of dogs, but not a single one of them were sick. And that's when they decided that raw food feeding was dangerous. That's the conclusion they came to.
yeah.
And it's like, what is that from? Because you were able to culture salmonella out of perfectly normal feces from perfectly normal dogs.
Yeah.
And probably if they did, like you said, if they did kibble fed, they may well find salmonella or maybe something worse in the
Yeah.
stools.
Yeah.
Very well could be.
Yeah, Eileen, you're 2 out of with 40-minute drives. Wow, she's got a problem. She's more urban. They all have the same hours, so she's just kind of like whoever's got whatever hours. Yeah, we're having a veterinarian crisis for sure. We just don't have enough, and it's just we're inundated, and it's
Yep.
very difficult. Dog
Well,
sheds.
there are shortages, and then the best kept secret is the burnout and the upset
Burnout.
about vets.
Yeah.
Some young vets are giving up veterinary medicine very quickly because they feel absolutely overwhelmed.
Mhm.
And you have your good clients and you have clients that can be absolutely brutal. And
Brutal.
What's that?
I said brutal. I know. And, I talk about it on
I got to tell you, I mean, I've had my moments as a veterinarian, because I cannot tell you, I do believe, even though I don't agree with colleagues, the majority of veterinarians didn't get into veterinary medicine because they don't care.
Right.
There are vets that are burned out. There are veterinarians who are tired. I used to do 3 shifts in a row, I was young and dumb. What can I say? I still think I did good veterinary work, but honestly, is that a good idea? In hindsight, of course it isn't. But there are veterinarians that are trying to pay off student loans that are over $200,000. The stress of that and not getting paid extraordinarily well in veterinary medicine, and then dealing with shortages, staffing shortages, COVID, and whatever restrictions anybody decided about COVID, as well as, clients upset and frustrated, and a growing distrust in the veterinary field is weighing heavily. And we're going to continue to have shortages because honestly, it seems stupid to get $200,000 in debt, which thank God I wasn't, because I'm old enough that I didn't accrue that much debt back then. But it's not unusual for young veterinarians to have that much debt. And for what? For a salary of $50,000 a year? And then they get long hours and abused both by the staff, the owner of the veterinary clinic, and maybe clients.
Right.
I mean, what an exciting job to come to! It really
I know.
sours the whole the room that nobody wants to talk about, because, and now I know we have, growing, I know a little bit of that, but there's growing sentiment, where people feel they've been wronged by veterinarians, and a lot of times, but not always, that isn't the case, but it felt that way. Or the vet could have done a better job, but they were still practicing within the standard of care, which I don't know is always such a good standard of care. But again, I'm skeptical about allopathic medicine because I see the harms it does. I see how allopathic medicine kills animals. Yeah. I see veterinary-induced diseases that I treat every single day in my practice. Yeah. And people are paying for that. Their animals are paying for that. It's heartbreaking.
I know.
And I think
it's so hard to hear that say.
Does not resolve with allopathic medicine, and that has to weigh on them as well. To know that they're working very hard and they're not solving the problems, and it's not for lack of trying or caring.
Right.
And what happens next? The customer, the client gets upset.
It's always hard for me to hear you say veterinary-induced disease. Every time I hear it, it just rips at me because I see it. I know the dogs when they come in, I can see their charts and I know exactly where they're going. But real quick, because then we're going to let you go because it's getting really late. But Eileen, wow, 3 years in the UK is the average printed in vet times. That's how long they're lasting before they just walk away from something that they spent most,
it's Eileen, it's becoming a very big crisis in veterinary medicine. It's happening in the US as well. I'm on some Facebook groups, which are private groups, well, one in particular, and I read the posts from some of these veterinarians, most of them that are young, and the heartache that I read, from pets that they've lost under anesthesia, that, they feel guilty and blame themselves for it, and yet there isn't anything identifiable with what they're saying privately that you're like, oh, wow, you really did make a mistake. How that wears on all of us, and that's the other elephant in the room nobody wants to talk about, is that all of us as veterinarians have lost animals under anesthesia or a procedure. Usually it's anesthesia. I don't know, maybe vets have lost animals. Well, there are other things too. They escape out of the office, get hit by a car or something. That's more rare, but it does happen. The most common is under anesthesia, young and older. Usually the ones you absolutely don't expect. The ones that you're like, oh, no way, these would be fine under anesthesia. And it's one of the most heartbreaking things we're ever going to go through. And those of us that never talk about it, I guess we just bury it. I think I've lost maybe 3 in my career. I've been a vet since 1991. But that's 3 too many. And it's 3 that, I'm never going to forget in my lifetime. And it's 3 family members, that never got to see their baby again. And all 3 were unexpected.
That's what's so great about, when you talk about, all veterinarians have lost. There's no way. I've worked for so many vet clinics over the years. Every vet clinic I ever worked at had lost an animal under anesthesia, or these things have happened. And you're right, vets push it and they don't want to talk about it. But the problem is the vets that do that, they forget about it. It gets put into their back of their subconscious, and then they don't learn from whatever, if it was indeed even a mistake. Sometimes it's just the time for the dog. I don't want to say it's always the vet's fault, because sometimes it's not. Groomers are the same way. I'm not a fan of PetSmart and Petco, but I know that they were getting a lot of heat over animals that were dying in their facilities. And so they're,
wow. Yeah, I think I'd heard, but I didn't.
But here's the thing. So, and people always think it's crazy that I talk about stuff like this. But I told you about the dog that I had to take to the emergency room that had a heart attack. That dog had a heart attack on one of my groomer's tables. She literally was doing nothing. A heart valve ruptured. And so there was nothing anyone was going to be able to really do for this animal. Plus, she was pretty old. So sometimes just being out of the house and things can happen. And so PetSmart and Petco got this big, and so my groomers were all like, oh my God, this is why I would never take my dog to PetSmart or Petco. And I said, you guys don't know why those dogs died. So you got to be kind of really understanding that sometimes you have to talk about it. I talk about the dog that died in my care. It's not the only one. I had another, a puppy die. Puppy walking through my daycare just had a heart attack, and he was not even 6 months old. And then when we got the x-rays back, I wanted to do a necropsy, but the owner didn't want to do it. But it didn't matter because they took an x-ray. It had an enlarged heart. She bought it from a puppy mill. And the saddest part, and then I'm going to let you go, I promise, but this one still gets me to this day. They kept bringing that puppy back but they were going to that free vet that the pet store gave them. And so it wasn't costing them anything. But the dog kept getting upper respiratory infections. He had already been on antibiotics 4 times and kept going back. And every time they'd stop the antibiotic, he would have this issue. Well, it turns out he had an enlarged heart the whole time. But guess what? The free vet never wanted to do any more testing. They never did any testing. So I don't know why.
Probably congestive heart failure that the puppy had, and not an upper respiratory infection. It was probably it could have been a congestive heart failure situation. Oh, you froze on my screen.
For an upper respiratory infection. So I don't know. Right. Well, I'm going to go ahead and
you froze for a moment there. So
I know I did, but I'm going to sign us off anyway because it's going on 5:20, and but I just want to
5:20 for you.
I know that's why I'm letting you go. It's
what about Eileen in the UK?
I know Eileen's like, it is like 1 in the morning.
Like, oh, it is much later than that.
So I'm going to let you guys go. Thank you so much for joining us. I'm here at Super Zoo, so I'm very excited because I'm going to get to learn some more stuff. But I'm so glad that Dr. Cannizzaro is here to teach you guys. So I'm always educating myself and bringing you the top people that I can. So thank you so much, Dr. Cannizzaro, for educating us.
Thank you so much. I really appreciate it. And I hope your listeners, were able to gain some valuable information. And it's absolutely a joy to work with you, Carrie. We'll have to do it again. Promise.
Always. To sign up. We always have that calendar. So
no, actually, I need to get with Lori about that so I can sign up for. Yes, I'd be more than happy to.
It's just.
And Lori, if I don't, Lori's in the background here, but Lori, if I don't get back with you, please remind me again. Please.
Yeah. We will. Lori, thank you so much. Also, she's the one that types up all the information for you guys, so we have it. And of course, to the listeners, thank you guys so much. And thanks for putting out the questions. They matter. They matter because it gets us going. We can answer different stuff and all sorts of stuff. So thank you so much for being a part of this community that we're starting, and it's growing. And the vets that we have every Wednesday night, 4:00 Pacific Standard Time. I'm sorry for those of you who are on the East Coast. I tried to make it so it wasn't too late for you and too early for us, which is really hard to do. But anyway, thank you guys so much.
Thank you so much. God bless everybody. Thank you so much, Carrie. Hope to hear from you again soon. Don't be a stranger.
Soon. Good night, everyone.
Good night. Thank you, everyone. Thank you so much.